Welcome. My name is Nicole Warshauer. I head up community at Trusted Health. And if you're not familiar, Trusted is the place for the modern nurse. We have everything from podcasts to blogs to resources for nurses and travel assignments across the country to other nurses or other opportunities for nurses to grow their career. And tonight we're going to be talking about advocacy and activism. And we want to go through a couple norms when it comes to virtual events. So a couple things to keep in mind: good vibes, good times. This can be a sensitive topic, so it's also a safe space. So have fun and be present and know that what you say stays in this particular event opportunity. Number two, we want to hear you when you want to be heard. So please stay muted unless it's time for discussion, and then by all means unmute or use the chat box. All you have to do is tap your unmute button to unmute. If you have questions, this is really important for this particular session. You want to use Zoom chat for public comments or public questions, but if there's something that you'd rather remain anonymous, go ahead and private message Casey Smith. And so what you'll do is you'll go to your chat box. Instead of sending it to everybody, you will tap that little blue box and hit the down arrow and type Casey Smith, exactly how it's spelled out on the slide. And then lastly, if you have feedback, your feedback makes us so much better. And we're really, really grateful that everyone is so helpful and honest and forthright when they talk about how the event served them. So you will get an opportunity to share your feedback at the end of the event, about 20 minutes after the event concludes. And we really appreciate your feedback. And so with that, we're going to go. I'm going to introduce our amazing hosts, Nicole Vance and Ashley Wood from the Capital City Black Nurses Association. This is the second time that we've worked with them, and they're just amazing human beings. And I'm so privileged that we get to call them acquaintances and now friends. So with that, I'm going to stop sharing and I'll let Nicole and Ashley take over.
Wait for it.
It always happens. I told you.
Every time.
Every time you say it's going to happen, it happens.
It wouldn't be an event if there wasn't some of this, truly.
Well, good evening, everyone. We're so excited to have you join us. My name is Nicole, and I'm going to be joined by Ashley Wood. We are with Capital City Black Nurses Association, and we were planning on having our Vice President, Ms. Cherie Kreiner, with us today, but unfortunately, because of a family emergency, she's not joining. So Cherie is with us in spirit. So Capital City Black Nurses Association is an organization in Sacramento. We are a local chapter of the National Black Nurses Association, and our aim and our objective and mission is resolving and combating health inequity and really focusing on representation, retention, recruitment within nursing as well. Ashley and I, as you have probably noticed, are not Black, and our role in the association has been supportive, and they've just welcomed us in and invited us along to help advocate and work with them in the community. So how today's going to go, what our hope is, our plan, our goal is that today's really going to be a discussion. The reason we wanted this, we talked about it initially, and the reason we decided to make it a discussion over a lecture is that getting a lecture about activism isn't quite as empowering. And the aim for us is that each of you will walk away from here a little more comfortable using your voice. For those of you that don't consider yourself an activist, don't consider activism or advocacy maybe a nursing role or something that you can jump into, we want this to be a safe space, an open space to learn together and to share. There's a lot of people here who have wisdom in this area, who have experience in this area, and we want to hear from you as well. So with the number of participants that we have, we really believe there's going to be a lot of wisdom here and a lot of insight. So we're going to talk a little bit about each of these things. And when we do have discussion and you do want to share, just like Nicole said, make sure to unmute your mic. And if you don't want to unmute your mic and talk, just throw something in the chat. We'll be monitoring that as well. So this is one of my favorite quotes by Marian Wright Edelman. She's the founder of the Children's Defense Fund, an amazing, amazing human activist and advocate herself. And this concept and what we wanted to open with this quote is because service, organization, activism, advocacy it's a way to express your values that you have, the way to put action to the things that you believe. And the way that I like to think of it is it's getting your insides on the outside. We all take up space in the world, and service, especially what we're going to talk about today, is how to live in a way that's in alignment with what you believe. There's such a, there can be such that dissonance internally. And when we have beliefs that we're not actively living, that we're not actively showing, that aren't showing up in our life. And so just one way to frame this as we have this discussion is this is an option for everyone. And it's based on who we already are. We don't want anyone, as we talk about this, to think that this journey requires you to be someone that you aren't.
So specifically what we're going to dive into today is we picked a nurse that kind of lit a fire in our soul, to put it lightly. Me and Nicole have done a lot of research over the last few months, and this woman stood out to us. And even though it's from 100 years ago, literally, it has allowed us to see where the nursing profession has grown from and where our roots are. So we're going to dive into that. We're also going to talk about health equity and community involvement specifics, how you as a nurse can get more involved in your community, how you can find your voice, find your actions, and some tools that you can use and to do the involvement, to do the work that you want to do, that again lights your soul on fire. And then we're really going to have good discussions. So I know we all kind of touched base on this a little bit of, this is a safe spot. We want you to participate. Please ask questions, share your experiences, share the troubles you've run into or what you've overcome. This is really a safe spot. So I just want to reiterate that again. You could go on, Nicole. And again, we're going to make mistakes. We're going to be fumbling, so don't worry. Safe spot. Okay, so we did this last time with our last talk too, of just talking about terms. And when we define the terms, we typically can just navigate through these conversations a little bit easier if we're all coming from the same idea of what these terms mean. So activism, our last talk was a lot on allyship. So now we're kind of growing into activism and advocacy. And so what we can do, the action words of allyship. And I think a lot of activism right now, when we think about this word, is protests, rallies, just because that's what's in our face right now. That's the season we are in as a country. But it goes beyond those. It can be petitions, it could be writing to newspapers, things like that. It's taking an action against something that you are against, or taking action to inspire people to promote something that you are for. So it could be either or. Community organizing. So there's this buzzword going around, grassroots, right now. So this seems to be the word that everybody's using on anything. And the reason why that's important with community organizing is these grassroots efforts are coming from the community. So communities know what they need. They know the gaps that are there. And so when these grassroots efforts come in and are organized and tackle those problems, they're going to do a great job, and they're very impactful because they know exactly what needs to be done. So we talked a lot about last time about coming in with your superhero cape. I want to make changes and do all this, when really just coming in with a servant's heart and how you can help. So we're going to discuss that today. And I like to compare this with nursing on units that you've been on. If there's been a culture shift or wanting a culture change, what was more impactful? Management coming in and saying, hey, change this, do this, or it coming organically from staff nurses to make those changes? So just kind of thinking about your own experiences with that will help. And then advocacy. So this is a big word for us as nurses. We, I think, get preached on from the time you're in the first day of nursing school. You are an advocate. And one of the definitions of advocacy is preserving human dignity. And I couldn't think of a better definition for nurses and our role for our patients, our role for the community, our role for each other. And this is just ingrained in us. And even if you are a new nurse, this is a part of you more than you can imagine at this point. And it's actually in our code of ethics, which is amazing. So the next slide, Nicole. So this is one of the most empowering things as a nurse. So, or I feel. So the ANA, American Nurses Association, added a provision number 9. So there's a fair amount of provisions in the Code of Ethics for the American Nurses Association. But in 2015, they added that integrate principles of social justice into nursing and health policy. And this just empowers me. It makes me feel empowered so much, because not only is this saying this is part of our duty as nurses is to step into the social justice arena as advocates, but we have an entire organization that's going to back us, that is standing with us. And our profession, there are thousands of nurses, not just in the United States, but worldwide, that we can link arms with and make these changes. And this just, I love that you have this as your backing. You have this as part of you being an advocate. So I really hope that by the ANA standing and saying this, it makes people feel empowered, and that all policy is health policy. And this is something I think we're starting as a culture to realize, that everything is intertwined and integrated. And we're getting more to that idea, but things like a big topic right now, global warming and environment and stuff is a huge topic. And we think about it environment wise, but everything, all those policies affect health. All the policies regarding education access, food access, healthy food access, transportation, all that comes down to health, and all that is intertwined. And what's really inspiring is nurses are at that crossroad. We are there. We are the profession with our hands and feet in every arena, and it's just really, really powerful.
So Lavinia Dock was a nurse in the early 1900s. She actually came from a pretty wealthy background and then spent most of her career working with marginalized populations. And as a result, became quite delightfully radicalized. She believed that nurses were a class of citizens most suited to assist others. And during the tuberculosis pandemic in the turn of the century, she was a constant reinforcer of her belief that the tuberculosis problem was a social problem, and that if we could address these social factors and at her at the time, her plan was, well, if we can just get women the vote, and at the time it was limited to white women, but if we could get women the vote, then maybe some of these issues would be more addressed, because she believed nurses were more perfectly positioned to actually create social change. She had a document that she wrote called What We Can Expect from the Law. And one of her sayings was, she said, so it comes down to this, not what can we expect from the law, but what can we expect from ourselves and from the people all about us. that it wasn't the obligation of law and government to make the policy changes and the social changes needed, that it was really the onus was on us, especially as nurses. So she had a really quite a nursey nurse history. She co-authored a history of nursing. One of the reasons she did that was because she believed that nursing as a profession, until we had documented its history, wouldn't be taken seriously. And until it was taken seriously, nurses wouldn't be able to advocate socially and politically. She also wrote the first nursing drug manual. And this is my favorite part, is quoted as listing the times that she was imprisoned for being an activist as the pinnacle of her career, as the absolute highlight and peak of her nursing career, that those were to her the most supreme joys of her service. She protested in front of the White House multiple times. She attempted to vote and was jailed for that and for protesting, and just really shook things up at a time where that wasn't always, I don't think that was really considered the role of a nurse. So much of our history has been dictated by, I mean, how much do we in nursing school, when we show up in nursing school, like what's one of the first things you learn is check the policy and what does the doctor's orders say? And I'm not saying that safety guidelines are somehow irrelevant and should be ignored, but it's ingrained into us as baby nurses, male or female. It is ingrained in us to wait and see how you're supposed to do it. And that's really helpful when we're dealing with sepsis, when we're dealing with algorithms, when we're dealing with direct patient care. But when it comes to social change, it's very handicapping. And that mindset, I think, can hold us back a lot. A lot of the comments that we noticed in the what do you hope to get out of this session were, what am I within my rights to do? How much can I, how crazy can I get? How involved can I get without getting in trouble at work, without getting in trouble outside of work? And I think something to remember is when you're learning how to express your values, and when you're acting in a way that's in line with what you believe, and what you believe is in opposition to maybe the culture of your unit or the culture of maybe your family, it's gonna ruffle feathers, and it's going to be uncomfortable at times, and you're not going to do it perfectly. And so we really wanted to highlight Lavinia just as an example for the just the fact that sometimes in the effort, in the process of doing what's right, you're seen as doing what's wrong. And so as each of us have our own journey, it's okay to be afraid of consequences, but don't let them stop you. If you really honestly believe that the path you're taking in this is right for you. So what we would like to talk about, just as our first discussion, with that in mind, considering health inequity, and we have, hopefully everyone that's here is aware of and up to date on the fact that there exists shockingly still very present health inequity in the US, especially in the US, from pain management disparities to maternal health mortality to asthma treatment for children based on neighborhoods that they're from or race and ethnicity. But in light of health inequity, what does it mean for you to be community minded as a nurse, to begin kind of thinking outside of the bedside? And so we're going to open it up for discussion. And if you could, if there's something that you don't want to maybe publicly say, text or private message Casey, but unmute your mic. And we want to, as we kind of move into our next spot, just really hear from everyone. What does it mean to you to be community minded as a nurse?
Hi guys, can you hear me?
Yes.
Okay, perfect. I'm trying to call in from a phone for the first time to a Zoom. I just wanted to say thank you guys so much for hosting this.
Yes.
And for me, being a community-minded nurse really means advocating for not only my patients when they're at the hospital, but trying to advocate for them to prevent them from getting there. And so that way we can use our resources to help everyone at the first point instead of the last one. So for me, that's really why it's important. So, yeah.
So almost like when they're at the bedside, you're having that like upstream implications conversation already when they're there.
Yeah, that's the point for me. So.
Please, everyone, ignore the next slide that I can't seem to back up to our discussion frame.
That's totally fine. So I was a pediatric ER nurse for about 6 years, and I think about those frequent flyers, and it's so easy to judge families or parents for bringing their kids back in repeatedly for those problems. But when you step further away, you realize this is not their problem. This is our problem. Like, we're either not educating them enough, or we're not giving them the resources to succeed at home. So there's some gap in our healthcare system. So I think kind of like recognizing those gaps and treating them and making sure they get the education they need is definitely being community minded, in my opinion.
Yeah, absolutely. Love that.
And a nurse shared to understand how the decisions you make at the bedside impact your community.
Yes, and I'm wondering, and there's not a way to do this anonymously, so I really want to hear more about that. I have some things that are coming to mind. Could you say that again, Casey?
Yeah, absolutely. To understand how the decisions you make at the bedside impact your community. Which I love that.
I really do. I really
well put. So feel free to message me more if you want to share.
Yeah. There's an impact. There's an impact that we have, that our judgments and decisions that we make at the bedside do impact our community. And then there's the whole separate issue, or not separate issue, but within that is, how is the health system that we're a part of impacting the local community? Mm-hmm. And how is it showing up or not for the community that it claims to serve?
Can you guys hear me okay?
Yes.
Yeah, so my name's Susanna, and I work as a behavioral health nurse case manager. And so we do a lot of post-discharge follow-up phone calls with patients, and discharge planning is really pivotal. So for the people who are at the bedside, making sure that they are set up with follow-up care, before they discharge, can really impact their readmission rates, can really make sure that we are utilizing those outpatient supports so that we aren't overtaxing the inpatient supports until we absolutely need them. So we're very grateful to our inpatient partners, and in the outpatient world, we work very hard to make sure that they're able to follow through with the recommendations that are made. And we see that as a big part of addressing social determinants of health and making sure we're being community minded.
Thank you.
There's a comment in the chat that I thought was really interesting from Alicia that says, we are conditioned so much in our practice that when we are called to creatively expand, we are stunted.
Ooh.
And it made me think today. I actually was listening to a patient who was in our hospital for a full 30 days and basically traveled throughout our hospital, ICU, OR, everywhere. And one thing he said was that nurses had to respond to these unspoken boundaries put on them, and that he wondered if better care would be provided if nurses push those boundaries further and spoke up more, because he thought the nurses were right and the doctors were wrong. And it was really interesting to hear him say these invisible boundaries that he wanted the nurse to push. And it was just an interesting place to hear that from with a patient. And then seeing that statement by Alicia, I thought it might be a good point of discussion of the advocacy role.
Yeah, there's the image of the nurse in our minds still, and I know this is what men in nursing come up against, and pretty much all of us. of the docile, obedient caregiver. And I think it's interesting to have a talk about advocacy and activism and have the response be, and I've seen this before in my own life too, when we say, let's talk about activism, what comes across is, I'm scared to use my voice.
Mhm.
Absolutely. I have another tidbit to share from a nurse. These are her thoughts. And she said, be aware of the community's needs and advocate for resources to address those needs in the hospital. Support local community organizations. Sometimes they are the experts in the community that can bridge the distrust between the community and the healthcare system.
Yeah. Yes. We're done. That's pretty much the last part of our talk.
Good, we're done.
Yes. Yes, there's a lot of, it's very natural. I think it's so human, but I would say as a nurse, especially being in ICU, I am so guilty of thinking that I know the solution and I know the fix, and I'm going to find that fix, and we're going to fix it with all my fix ways, and come in with so much arrogance and supremacy and completely miss what's actually already happening.
Yeah.
Yeah, that's such a good point. Like, we go into these situations and we're fixers, we're healers. We want to make everything go away, but maybe we're not the right person. Maybe we need to step back and listen. There's better people to address the problem. But it's definitely in our nature to want to make things better. And I don't think it's a bad thing, but maybe we just need to take a step back too. I have another one. I work in emergency medicine and also doing SANE. I can't remember. Yes, I can't remember what SANE stands for. Okay. Finding the balance between fostering the teaching independence that will keep folks out of the hospital, but also attempting to show that our hospital is a safe space for folks who need resources and what we want to see them and care them for. And it's sexual assault nurse examiner.
Mm-hmm.
Do you want me to read that again? Because I feel like I kind of,
Yeah.
I'm sorry. I work in emergency medicine and also doing SANE. Finding the balance between fostering the teaching and independence that will keep folks out of the hospital, but also attempting to show that our hospital is a safe space for folks who need resources and that we want to see them and care for them. I'll copy and paste that. Why can't I do that? I don't know if I can actually copy and paste on Zoom.
No, that's true. There can be an element sometimes where I think we feel like we're caught in between the two.
And that they're almost going against each other. And it's this tightrope that we walk. And I think we tend to get better as our career goes on, I think, hope. But we still stumble.
Hi, everyone. My name is Alicia. I just kind of want to comment on that last part. It is a very difficult tightrope, as you said, Ashley, of trying to find this is what hospitals are, this is what this hospital system can do for you, and you should go to the hospital for these things. Yet we've conditioned our communities to think of hospitals in a certain light, and certain communities see hospitals in different ways than others. And sometimes it's not about the education, sometimes it's about the cultural differences and the cultural histories that are associated among those decisions. And as nurses, we've always been told you got to take your bias out of it, you got to do this, but we come in with our own experiences and our own biases and our own histories that determine our processes to help our patients in the best way possible. So all these wonderful, murky dichotomies are all associated within that one moment, within those 10 minutes you probably have with your patient, those really 10 crucial, private, beautiful moments you have with them that can really determine which way things go. And if we don't feel empowered and don't understand those wonderful nuances that nursing really has, like, we play so many hats,
Yeah.
but we have these, like, we're in those wonderful moments that are really crucial to advocacy, to policy changes, to just changing our mindset, that I feel like we're we are noticed, or we're told about it in nursing school, and then when you experience it, you're like, oh, this is what they were talking about.
Mhm.
But we can pivot those things to make for better change, overall. Hopefully, I just kind of rambled on, but I feel like that's what's something I just had to say, um, to really express what these moments we're talking about, you know?
Mhm.
I think you put it beautifully. And I love the 10 minutes of beautiful moments, but murky waters, and that's nursing in a nutshell. And you put it so poetically, and I just love that.
Yeah, I wrote down on my notes, murky dichotomies. It's so true. Is it okay if we move on? I've had this slide up here just taunting everyone, but is it okay if we move?
Well, actually, I think someone had something to say. I heard something.
Yeah, it was me. Sorry.
No, you're fine.
I think kind of going off of what Alicia said, it is kind of understanding that there exists a lot of mistrust in different communities, especially the minority communities, and understanding like that the way you treat patients and the care that you provide um, can sometimes maybe validate mistreatment or can maybe validate that mistrust, right? Because a lot of patients will go back and they speak to their family, and you know that's a lot of times how you get your advice is from your community. A lot of people will go to older family member of what to do. Hey, I've been having headaches, or I've been getting faint, lightheaded. They will trust maybe an older family member or a close friend before they would actually seek medical advice. And so those experiences can really change. I speak to a lot of people who say, oh, don't go to this hospital. They, killed my grandma or whatever, not really understanding the situation. And so what they take from it is, don't trust healthcare, don't trust that hospital. And so just understanding that any small gesture could really have a larger impact on the community.
Yeah, thank you, Erin, for sharing. I would be remiss without mentioning that Erin is our secretary for CCBNA and has his camera off because he has just woken up from working night shift. He's an assistant manager at our hospital. Thank you. Yeah, there's a huge history within healthcare of what I would term predatory treatment of marginalized populations. And this isn't necessarily part of the content, but what I'm reminded of is how, even the early Nazi Party, when designing their eugenics program, borrowed a lot of inspiration from American healthcare at the time. And so this mistrust that we encounter isn't unfounded. And it has a long historical background that's deeper and more nuanced. And Alicia, I love that you mentioned the importance of holding space for the nuance with our patients' experience and where they're coming from. All right, is it okay if I move forward? So getting started. That's the big question, right? Well, how do I get started? Am I just yelling at doctors now? What do we do? And I would say first ask who's already doing the work you're passionate about. What is it for you? What inequity? We don't have specific slides on organizations to join and activist groups to join because there's so many. Just pick one. Pick something that pisses you off. Pick something that lights you on fire. And look on Instagram, look on Facebook, look on Google, and what's in your area, or what's a national organization. If there's a national organization you're into, do they have a local chapter? And then most importantly, what kind of help are they asking for? Not what kind of help do you think they need, but what kind of help are they asking for? And where can you fit in? What can you offer? It doesn't have to be a lot. Offer what you have, not what you think you should have, but what you have. And we'll talk about resources and Toolbox. Social media, again, is a huge, 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 huge resource. It's not just a place where you can share your views, but it's a place where you can find people who think like you and who are doing things in line with those values. There's a couple activism, there's an organization in Sacramento Tenants Union, that advocates for housing rights for people during the pandemic. And they have, just through following them on Instagram, the knowledge and wisdom and workshops that they have put on and resources that they have provided has been phenomenal. And they're doing it for free. And so finding those organizations, volunteering, donating, and supporting. And then share within your network. We have journal and reflect on here because any type of work, especially I think as someone who, what is the phrase, conditioned, we've been conditioned as nurses, this is going to be a growth journey. So you really want to have that space for yourself for reflection and acknowledgement of the changes that you're going through, the beliefs that are being uncovered. And so that you're not, I think it just softens the process. Like, growth is hard, change is hard. And being able to journal and reflect about it is such a great way of creating safety for yourself while doing something new.
All right, so we talked a little bit about networks. It's almost like we planned these slides in a row. So our spheres of influence. So this is a nice little graphic. I like it because it's kind of all encompassing. It shows a little bit of overlap and everything like that. So when we're talking about sphere of influence and relationships, it's your networks and how you influence your networks, and especially with the initials RN behind your name, that is a huge influential initial. And I hope that empowers you. So how can you influence your group, your networks, your different ones? And regardless if that's your immediate family, your coworkers, and at work, it might look different. It might be mostly RNs, or it might be mostly RTs or doctors. It's whoever you already have those relationships with. And the sphere of influence is not a term that you obviously like go around going, my sphere of influence is. It's just becoming aware of these networks. And when you're aware of those networks, you can help communicate better. You can engage on a more meaningful level. So one of the questions before our talk was, how do I'm a part of church groups, I'm a part of nursing groups, I'm a part of Facebook groups, all these different organizations, like how do I influence? And part of it is you already are just by being there. So if you keep your ears to the ground and see where your tools are needed, like Nicole said, your influence can go a long way. And another way to think about this also on the flip side is the state of overwhelm you might feel, that we all feel these days, of your sphere of influence is kind of also your sphere of control, that all these giant big things that are happening in the world, if it freezes you, like if it's too far out of your influence, then kind of set it aside. What can you do? What can you contribute? And that kind of helps reduce the overwhelming feeling. That helps me a lot with that. Next. So since we are nurses, we wanted to throw in some nursing organizations that are out there. And I just want to reiterate that these nursing organizations are grassroots efforts. So all of these associations were started by the community and with a need, and they've grown on that. And so, for example, the National Black Nurses Association was founded in 1971, but it didn't just, we're here in 1971, we're an organization, and just like that, it happened. No, it took almost a full decade of different organizers traveling from LA all the way from New York to meet up, organize, and figure out the goals of the association, and it blossomed into this wonderful national organization. So just knowing that, I really encourage you to join whatever nursing organization appeals to you, or go to a bunch and see where you feel like you can help, or where you feel comfortable, wherever, or whatever you're getting the most out of it. So there are so many. So I really, really encourage you to just research local chapters around and just show up.
And I think something to note, and the reason that we have these slides on here is one of the, I think, roots of a lot of the inequity that's endemic to healthcare and nursing is that how much we've made whiteness the norm, and how much, the image of a nurse is someone that looks like me. It's someone that looks like Ashley. And there's a real, I think, intentionality that needs to be at the forefront of our minds when approaching organizations. I would just say, as someone who's white, is just being aware. And we're going to talk a little bit about impact and intention, but being aware not just of your intention, but your impact. And really, and that's why we stress this, is what kind of help are they asking for? Because oftentimes these organizations, they're the ones that are going to be aware of what's really needed in the community. And they're the ones that are being called upon to teach and advocate and help within the communities. So I just want to put that shout out to my fellow whites. So what's in your toolbox? What do you have to offer? What do you have to give? And as with any toolbox, there's so much more crap in there than we realized. So there's the stuff, there's time, there's money, there's relationships and networks, there's training. We also have a lot of unconscious things in our toolbox. And so sometimes the job that we show up to help with isn't the job that we end up doing. But we really do have, that quote that service is the rent we pay for living. There's always time. And for those of us where there isn't time, there's other resources and ways that you can support work that's already being done. And I want to talk about, before we go on to the next discussion, building trust with community groups. And this is really, I think the most important thing with building trust with communities is consistency, is authenticity, and it's showing up with where you're at, but also not putting the burden on the group that you're serving to educate you about their experience. The phrase that I think guides most of my practice, however imperfectly, is that impact over intentions. And this is really, at the end of the day, it's also a clinical perspective. When we have sentinel events, when we have med errors, we don't ask, well, in a just culture, we do ask, did the nurse intend to cause harm? Because that weighs in to understanding the complexity of the problem, but it's the impact that sounds the alarm. It's not the intention of the caregiver. And so when we're working with community groups where there is a very justifiable lack of trust at times, being aware of our impact, how we're showing up, what kind of space are we taking up? Someone had put in the comments of a decolonized and non-performative perspective of advocacy and activism. And I just thought that was so perfect for describing really where, as nurses, I think we should be coming from. And I'm just speaking as a white nurse, the focus and the framework that makes community work and trust building possible. So what we'd like to do then next, I had a moment, I just thought I had another slide in there that I didn't. But with our final discussion, what I'd like to talk about as a group, and if there's other things that are on your mind, this is not we're not so committed to this topic that we have to discuss it at all costs. If there's other things that this is bringing up for you, please by all means chime in. But for our final kind of bringing this ship home to land, what does impact over intentions mean to you? Not just clinically at the bedside, but when it comes to community work, when it comes to community involvement, activism, advocacy, what does this mean to you? And if there's other things that are on your mind that you want to discuss, please, by all means, message Casey, put it in the chat.
While I'm giving everyone a chance to gather their thoughts, I can just let you know a few things that were shared in the chat while you were talking. Susanna asked, what is the name of the Sacramento organization? And Aaron shared Capital City Black Nurses Association. And then Jennifer shared that the National Nurses United is the national branch of the California Nurses Association. In addition to the local contract and jobs that they do a ton of community lobbying, including environmental work and legislative work. So many people don't know about that part. I just wanted to share that.
Thank you.
I think Susanna may have been mentioning or asking about the organization that you mentioned, Nicole, that about the housing.
Oh.
The housing, Sacramento Housing
Oh,
Tenant.
Sacramento Tenants Union.
Thanks.
Mhm.
Thank you. You know, I am reminded, I had something happen this week at work. Ashley and I both, we didn't tell you this, we're both pediatric ICU nurses. And the unit I work does a lot of peds cardiology. We had an adult patient with a congenital heart defect. So he was on our unit. And he's had the last 18 months, a lot of no-shows in the computer and hasn't been taking his meds, has been coming back in for seizures. And they were rounding in the morning, young African-American male, and the team was talking outside of his room. And the cardiologist and the cardiothoracic surgeon during rounds were saying, well, why would we schedule a cath? He's been so non-compliant. It's just gonna be, we're gonna, fix this baffle and we're gonna send him out and he's not gonna get follow-up and he'll be worse off. And in that moment, I wanna believe that they really did have a form of really good intention of, well, big picture, it's just gonna set him up to be worse off. So there was an intention there in some regard, but it did not sit right with me, because one of the things that I think we do a lot in healthcare, I'm guilty of this all the time, is who do we give the benefit of the doubt to? And who do we give the benefit of curiosity to versus assumption? And we talk about activism at the bedside. Oftentimes activism and changing culture in your hospital, in your unit, is inviting curiosity. You don't have to come out and say, I think that's really messed up, head of pediatric cardiothoracic surgery that I'm super intimidated by. But creating a culture of curiosity instead. And I remember during rounds just saying, okay, but do we know why he hasn't come in for his appointments? Do we know why he's not taking his meds? Do we know who's helping him at home? And how's that person doing? Because 2020 has been a shit year. And are we really going to make clinical decisions without finding out anything else going on within his home, within his history, within his family, with the resources that he has and what he wants to do? And sure enough, a 5-minute conversation that day with him. He's had a couple friends pass away, and since then has just lost the drive to do any of it. And his mom decided to stop forcing him. And so I share that to say, for me, that's really what impact over intentions can also mean, is just when it comes to clinical bedside nursing, being aware of what we think is really driving the boat or driving the bus, being aware, because at the end of the day, it's our impact that's going to matter, and it's our impact that's going to last regardless of our intention. So thoughts?
Well, I was just kind of reflecting on this phrase for a while. And what I was kind of thinking is that for me, the impact kind of takes your intentions to the next level. Like you can have the best intentions for your patients, you have all these great ideas, but if you don't have a way to really put those intentions into action and do something with it, those intentions may never have the opportunity to make an impact for your patient.
I've never thought about it that way. I really like that perspective.
There's a little bit of a chatter in the chat talking about how the word non-compliance is really unfair and it drives people nuts. And people are in agreement essentially. And, you know, we say, Ruth shared that we often judge the patient to be non-compliant, but healthcare workers are also non-compliant when it comes to our own health, self-care. I think we can lead by setting good examples in the arena. And learning about the social determinants of health really brings to life comments made about non-compliant diabetics.
We were talking about this today with a friend. Who do we call non-compliant? You know, how often is it connected to race, to class, to socioeconomic factors? How able are we to see what we would call non-compliance in a wealthier, more privileged, put together patient? Would we call it non-compliance? Would we call it something else?
I agree, because if you talk to fellow nurses, like we talk all the time on our unit of, oh, I haven't gone to get a mammogram and I've never been and I'm 50, or I don't get my annual like pap smear and stuff, and it's like, oh, that's been 7 years. But we don't consider each other non-compliant. It's just, oh, it's busy. Oh, we're nurses. And it's a really interesting perspective of who we put labels on that. But I don't think we would do that to each other.
I think it speaks to also the reason the phrase non-compliance is so, I hope we as a nursing society will evolve past that phrase, is that it speaks to the power we actually have. That we have the power, just like that cardiologist, he has the power to deny a life-saving procedure to a young man who needs it because his opinion of that young man's involvement in his own care without ever asking. And I'd love to say, oh, that evil cardiologist, but I do it too all the time. You know, we have such power. Who was it talking about? There's a murky dichotomy for you. I'm going to use that phrase and I'm going to credit you all the time, Alicia. Here we are in these intimate moments with people sharing this intimacy, and we have so much power.
Well, I think this is Alicia again. I love how you said that, Nicole, because we do have so much power, but yet within the profession that we are, we've been conditioned to not be empowered. And it's not until we either gain some experience or we get to a point in our careers or to a certain place where we're like, oh no, we have power. And we have the confidence to stand in that power as a whole entire group. No, like this is why we're still in the same ways that we're in as a nursing profession. Even though we are being more respected than I think from before, there's still that power dynamic between us and, you know, our doctors. Even though there's a change in that perspective as well. But because we're still trying to find our niche and our like confidence as a whole group, I don't think that our patients will be served the best way until we come collectively into our own power. Because there's like, just in America, there's like something like 1 or 2 million of us. Yeah. Like we could literally rock a whole fucking vote in this country and not bat an eye about it. But do we? No.
Yeah.
And, I just say a vote because like we literally just came out of election, but that whole like power, like there's power in people and there's power in voices, and our voices come from a place of empathy, and they come from a place of service and understanding that human life is precious regardless of where it comes from. And I think like what you said before about Lavinia is that was her whole premise. Like, this is why we become nurses. And this is why this is probably the best profession ever. I'm hella biased, but there hasn't been something else that I've seen in this world that of people who do what we do. And we need to take that and not turn it into like this political scheme or whatever, but take it for what it is and be, no, like this is why we do what we do. And this is how we can make impact. And this is why you need to listen to us. And this is why we need to put power in these places, because it's going to help the better part of not just people, but our economy, our social constructs, our environment. Like you said, it affects everything.
Yeah,
I agree.
Yeah, there was a class on community organization that I remember this gentleman taught, and a lot of it was based off of the work of Cesar Chavez. And he said, you build trust by sharing your story, and being authentic and talking to people, but you gain respect by using your voice. And he said, as an activist, just as a person, if you don't use your voice to speak up for the things that matter to you and that matter to you about other people, how can anyone else respect you? And he gave an example of coming into a space where the union or the organization had a meeting with an elected official, and the elected official, they had an agenda, and the elected official sat down and just started running the meeting, even though they had an agenda printed out for him of how it was going to go. And it was a predominantly Hispanic organization. And he said, everyone in that room just jumped, yes, sir, I guess this is what we're doing now. And he said it was such a struggle for him, but he realized that how could this elected official who's working for us, mind you, how is he going to respect us as an organization if we don't speak up in this moment? And so he interrupted it and he said, I'm sorry, excuse me, sir, but you're here for us. You're here on our time. And we have an agenda in front of you, and this is what we're going to talk about while you're here. And he responded, and it shifted the whole course of the meeting. But that concept of the use of my voice being currency to gain respect was mind-blowing. And especially with that culture of, yes, doctor, when we speak up, when we advocate during rounds, someone respecting us doesn't always mean that they will like us. But we still gain respect.
And just to add to that really quick, because I know it's almost time to go, but Maria also shared, that reminds me, I feel like part of activism is being aware of how we talk about patients and staff with each other. And I think this kind of builds off of that too, and having a voice then. I believe that even changing how you present your report on patients, in some ways you can start shaping the culture within the unit.
Yeah.
Using your voice in those communications is really important. I agree.
Yeah.
Mm-hmm.
Well, that's right. I have more slides. So as we close out, if you guys could just in the chat box, what is on your mind as far as a first step or a next step in your own journey of activism and advocacy as a nurse? And then we'll just glance at them all together. While you're thinking, I'm going to share this quote with you. Joining a local nursing organization chapter, yeah. Search for more organizations on social media. Yeah, this is awesome. And I can't talk about community organizations without mentioning the generosity and graciousness of Carter Todd and Cherie Kreiner from CCBNA. They're personal friends, and so our involvement was, we were invited to join. And I'll be honest, we had a lot of imposter syndrome about it. And just the consistent generosity, encourage, just opportunities to serve has been very life-changing. Find something that pisses me off and go from there. Yes, Kenzie. Yeah, if you ever want to know how to pick a project, just start with what pisses you off.
It's a very good start.
Thank you. Yeah, thank you, everyone. There's no wrong place to start, right? I think the only wrong place is in not starting, and is in saying that somehow your voice in this doesn't matter and that you don't have power in this.
Absolutely. Nicole and Ashley, thank you so much for guiding us through this chat. Hope there are more to come. As I mentioned before, we would love your feedback. So if you love this as much as I did, and I'm not even a nurse, I would absolutely encourage you to share some feedback, good, bad, and indifferent. And we have a couple more events coming, or just one more event coming up at the end of the year, which will be shared live on Friday. And for more, we have so much already in the works for 2021. So we're very grateful for you. Please stay safe and healthy, and we'll see you all hopefully very soon. Good night, y'all.